Hi, we are going to see Behavioral System Model by Dorothy E. Johnson and the theory's application in nursing practice. When the nurses use nursing theories and the evidence based on theories in order to form their skill, it will lead to improving the quality of the patient care. Regarding the theorist, Dorothy E. Johnson was born in 1919 in Savannah, Georgia. She did her master's in public health. This grand theorist presented a paper, One Conceptual Model of Nursing, in the year 1968. She was an active speaker, an author, and an advocate for nursing. She had published a number of books, numerous proceedings, reports, and abstracts. Johnson developed her behavioral system model later in 1992. The conceptual framework was formed in 1968 and later on the model was developed in 1992. The theorist passed away in the year 1999. She gave priority to research-based knowledge. Johnson stressed that nursing had a unique, independent contribution to healthcare. Nursing is distinct from delegated medical care. She stressed that nurses are not to carry out the delegated activities of the physician. Their activities are unique and independent from the physician's. She served in various posts during her career, and she has addressed issues relating to nursing practice, nursing education, and nursing service. She was a pediatric nursing advisor at CMC School of Nursing, Vellore, South India. And also she worked with the California Nurses Association, National League for Nursing, and American Nurses Association. So this is all about the theorist. The typology of this theory, as already we have seen, this is a conceptual model. The assumptions of Johnson's model. The first assumption, or what the theorist believed, person is considered as a behavioral system by Johnson. The person will interact with the environment and behave. So person is considered as a behavioral system. A person is conceptualized as an open system with organized, interrelated and interdependent subsystems. The behavioral system has got some subsystems also, and these subsystems together form the basic system, behavioral system, and these subsystems are organized, interrelated and interdependent. Also, human being is considered to be an open system. Open system means it interacts with the environment. So this is one of the main assumptions of Johnson's model. Next, the whole of the human organism or the behavioral system is greater than sum of its parts or subsystems. We cannot tell by combining together the eliminative system or the ingestive system, it will be more than human being. Human being is greater than the sum of its parts. Neither has continuity and identity without the other. All the systems should be together, then only it will form the behavioral system as a whole. A system tends to achieve balance among the various forces operating within and upon it and continuously strive to maintain an equilibrium. The main purpose of this behavioral system is to maintain an equilibrium with the internal and external forces. A behavioral system's balance reflects adjustments and adaptations that are successful. So behavioral system will be trying to adjust and adapt. Later on, that should be successful. Then only this behavioral system will be in balance. The term adaptation is defined as change that permits the behavioral system to maintain its set points best in any situation. The maximum a person or a system can achieve, that is known as adaptation. A person's activities in the environment lead to knowledge and development. As one interacts with the environment, the person will be developing, gaining knowledge, and will be adjusting to the environment. So these are the assumptions of Johnson's model. Moving on to the propositions of Johnson's model. Proposition means the relations between the concept. The behavioral system is linked with the environment. We know already told that the behavioral system is an open system and there is an interaction with the environment. And the system is self-maintaining as long as the conditions remain orderly. So we are healthy because we are able to maintain self. There is a balance between our system and the environment. So that is one proposition. Second one, the balance is essential for effective and efficient functioning of the person. So a person's system should be in balance with the environment. Then only as a person, the person will be functioning effectively and efficiently. The lack of balance in the structural and functional requirement of the subsystem lead to poor health. So subsystem has got two requirements. One is structural and the other is functional. When there is a lack of balance in both these requirements, that lead to poor health. In the next coming slides, we will be seeing what are the structural and the functional requirements of the subsystem. If the behavioral system balance returns, there is no need for intervention. And if that balance is not coming, the nurse intervenes to help the patient restore the behavioral system balance. To make the balance, the nurse has to intervene. Next, moving on to the major concepts in Johnson's model. The first concept is behavioral system. As already told, human being or man or client is considered as a behavioral system. This behavioral system is an orderly, repetitive, systematic and organized way of behaving. All human beings have got an orderly, systematic, repetitive and organized way of behaving in order to maintain homeostasis by an individual. To maintain a balance between the environment, all human beings will be doing some orderly, repetitive, systematic and organized way of behaviors. As a behavioral system, man has interaction with the environment. So this is regarding the concept behavioral system. Next concept is subsystem. We have already told the behavioral system has got subsystems. The parts of the behavioral system are known as the subsystems. They carry out specialized tasks or function to maintain the integrity. Each subsystem has got their own task and function. The subsystems have a set of behavioral response that is developed and modified through motivation, experience and learning. Each subsystem will behave in a particular way, and that way is developed and modified by motivation, experience and learning. For example, if we are thinking about the ingestive system, how we are taking our food, how we are consuming our food. As a child, we might be having different behavior of taking the food from the plate and having it. But as we grow, as we are experienced, as we learn the things, we understood about the table manners and how to take the food we learned. So that is how the subsystems behavioral things will change. Johnson identified 7 subsystems, but at present when we are discussing, we will be seeing 8 subsystems, which is later on given by Grubbs in 1980. The third concept is behavior. Behavior is the output of the stimulation, the responses to a variety of stimuli present in the surrounding environment that are purposeful. So these responses which we do are always purposeful. The behaviors are orderly, purposeful and predictive most of the time. When we are hungry, what we will do? There is a purpose, there is an order in doing, and we are able to predict what a human being will be doing most of the time. Then other than these main concepts, we can also tell concepts like equilibrium. That means the stabilized or a resting state in which the man is in harmony with himself and the environment. That is known as equilibrium. So that is also a concept. Then the fifth concept we can tell is stressor. It can be an internal or external stimuli that will produce tension and result in instability. Next comes tension. Because of stresses, tension will develop, which can be constructive or destructive. And it is the system's adjustment to the demands, change or growth. And we can also consider another concept, that is instability. That is the state in which the system's energy is depleting and the energy is not there to maintain the stability. At that time it is known as instability. So the concepts of Johnson's model are behavioral system, subsystem, behavioral, equilibrium, stressor, tension and instability. We told about 8 subsystems. The first subsystem is known as affiliative or attachment subsystem. Second is dependency. Third is ingestive. Fourth is eliminative. Fifth sexual. Sixth aggressive. Seventh achievement. And eighth is restorative. So these 8 subsystems constitute the behavioral system, or the man is composed of all these 8 subsystems. We are going to see one by one what all these subsystems are. The first one is attachment subsystem or affiliative subsystem. To achieve intimacy and inclusion, to relate to someone or something other than oneself, that is known as attachment. This is a part of forming a social system. We are attached to someone. We are affiliated. So that is the first subsystem. Next is dependency subsystem. Dependency. It promotes helping behaviors that call for a nurturing response. We are dependent on the other person. It focuses on approval, attention, recognition and physical assistance from others. Interdependence is essential for the survival of a social group. So second subsystem is dependency. One is dependent on the other. Third one, ingestive subsystem. The emphasis is to sustain life through nutritive intake. When, how, what, how much and under what conditions we eat. These are all coming under ingestive subsystem. Eliminative subsystem. When, how and under what conditions we eliminate the biological waste. Social and psychological factors which are influencing the subsystem all are considered in the eliminative subsystem. Sexual subsystem. The dual function of procreation and gratification. That is the function of the sexual subsystem, and we will develop the gender role identity under this subsystem. Both biological and social factor affects the behavior in the sexual subsystem. How we behave as a sexual being, that is dependent on the biological and the social factors. Next is aggressive or protective subsystem. Protection and preservation from threats to self or to others. And also one that generates a defensive response. When we are attacked by somebody, we will show some response. So that is in this aggressive or protective subsystem. Achievement subsystem. To control or master self or environment to some standard of excellence. When we are achieving something, that means we are excelling in something. The areas of achievement behaviors can be intellectual achievement, physical, creative, mechanical, and in social skills. The last subsystem is restorative subsystem. To relieve fatigue and achieve a state of equilibrium by re-establishing or replenishing the energy. Again going back to the state of energy. To produce a relaxation of the self system is known as the restorative subsystem. This subsystem has got two components. Already in one slide we have seen. One is the structural component and second is the functional component. All these subsystem has got four structural components. Whatever the subsystem is, ingestive, dependency, eliminative or any other subsystem, all subsystem will be having a goal, which is also known as a drive. Then it has got some set criteria. Then it will be having a choice of selecting some option which will result in the behavior of the subsystem. So each subsystem has got four structural components. We will see one by one. The four structural components, first one is the drive or the goal. The goal means the reason or the motivation for the behavior of the subsystem. For example, hungry. When we are hungry only we will be showing one particular type of behavior. So that is the drive or that is the goal. Second is set. Set means the normal behavior the person use to meet the goal. It is a learned behavior and it is influenced by knowledge, attitude and beliefs. This set contains two components. One is known as perseveration. Perseveration means you already know how to react to a stimuli. Usually how one behaves when one is hungry. Some will be angry, some will be agitated, some will be doing some other things. Okay, so that is perseveration. And the another component is preparation. That is priority for attending or not attending to stimuli. So whether you will be going and having your food or you will keep it for later on. So two components are there for your normal behavior. One is perseveration and the other is preparation. Next is choice, the third structural component. Options that are available to the patient to meet his or her subsystem goals. It is affected by variables such as gender, age, culture, socio-economic status and health status. For example, somebody will be eating by sitting on the table. Somebody will be eating sitting on the floor. So it is based on the culture or it may be based on the health status. So choice is there for the person to meet the structural component or to do the behavior. Last one, how the person acts or the behavior. The consequences of the previous three structural components. So that result in the behavior. This is the only structural component that can be observed by a nurse. We cannot see the goal of the person, we cannot see the set of the person, we cannot see the choice of the person. But how the person behaves, the nurse can see. The next part is the functional component of the subsystem. The functional components are the inputs that the system must receive to survive and develop. So each subsystem should be receiving certain things so that they will develop and that subsystem will survive. There are three requirements or the three functional requirements are: one is to be protected from noxious influence with which the person cannot cope. For example, if the person is a vegetarian and we are providing non-vegetarian items or some toxic items which they won't be able to take. So as a nurse, we should protect. Protection should be there from the noxious influences. That person won't be able to cope with that. Next, to be nurtured through the inputs of supplies from the environment. The person should be given all the healthy things so that that subsystem will grow or nurture nicely. The third one, to be stimulated to enhance growth and prevent stagnation. We should promote the growth of each subsystem so that it will be functioning in a very good way. So protection, nurturance and stimulation are the three functional requirements of the subsystem. So subsystem has got both structural and functional requirements. The structural requirements are four: goal, set, choice and action, and the functional requirements are three: protected, nurturance and stimulated. This is the picture of Johnson's behavioral system model. So this is our patient. The patient has got some behavioral disorders. The behavioral disorders or sickness, it is because of some imbalance between the environment and the person. That has resulted in some stress on the person. That stress and forces will act on all the subsystems. It will act on all the 8 subsystems, and sometimes the person is able to cope up or adapt. That is, effective functioning and adaptation can happen. Sometimes it is not adapting properly. Ineffective functioning and instability happens. So at that time the nurses has to help or has to intervene to again make the system in balance. So ineffective means again it will act as a stress to the whole subsystem. So this is Johnson's behavioral system model. The theoretical assertions are the main points which the theory says. System and subsystem tend to be self-maintaining and self-perpetuating as long as the internal and external conditions remain orderly and predictable. If the functional requirements are not met, subsystems are not harmonious and dysfunctional behavior will result. Behavioral subsystem manages its relationship with its environment. So there is a balance. This behavioral subsystem appears to be active. All these activities of the subsystems are active process. It is not a passive process. Johnson considers nursing different from medicine because nursing sees patient as a behavioral system and medicine sees patient as a biological system. And when the problem is there in the behavioral system, the nurse will try to do her action and bring the system to balance. Meta-paradigms and Johnson's theory. The first meta-paradigm is the person or human being viewed as an open system with organized, interrelated and interdependent subsystems. The whole of the human organism is greater than sum of its parts. Behavioral system in an orderly, repetitive and organized manner maintains relationship with the environment. It strives to make continual adjustments to achieve, maintain or regain balance to the steady state that is known as adaptation. So this is what the human being is. Next is environment. Consists of all the elements that are not a part of individual's behavioral system, but these elements influence the behavioral system. This environment can be manipulated by the nurse to achieve health. There are two types of environment, internal and external. Internal environment include external environment include other people, objects, phenomena that can potentially permeate the boundary of the behavioral system and can disrupt the system. Internal environment include a person's physiology, temperament, ego, age, related developmental capacities, the person's attitudes and self-concept. So these environments thing or the external and environmental thing, it is a basic area for nursing assessment. Health. Johnson defines health as the efficient and effective functioning of a system. Behavioral system balance and stability is there means the person is considered to be healthy. Last, nursing. It is considered as an external regulatory force which acts to preserve the organization and integration of the patient's behavior at an optimal level under those conditions in which the behavior constitutes a threat to physical or social health or in which illness is found. So nurse is an external regulatory force when illness occurs. Nursing views patients as behavioral systems and medicine view patient as a biological system. Nursing activities, they are not dependent on physician, but they are complementary for physician's measures. This is a point we as nurses need to keep in mind. Goal of nursing is to restore or maintain behavioral integrity, stability and effective and efficient behavioral functioning. The strengths and limitations of this theory. The strengths are, this theory is a frame of reference for nurses concerned with specific client behavior. Why the person behaves in this way? When we understand the structure, their goals, set, choice and behavior, we will come to know why each person is behaving in different way. can be generalized across the lifespan and across the cultures. We can use it for any age, any person, anywhere. The theory serves as a tool or gate to motivate patient or the behavior of man during distress. So the nurse can help in guiding the patient to change the behavior. The limitations: the model is very individual oriented. We are considering only a man and not the society. So nurses working with the group have difficulty in its implementation. And also the family of the client is also not considered in the environment. It does not define the expected outcomes when one of the systems is affected. What outcome should be expected from each subsystem? It is not given clearly in the theory. It fails to include and give importance to the nursing process in her theory, and instead the theorist focus on the behavior of the client in response to illness or disability. There is a difficulty to test Johnson's model by development of hypothesis, and theory focuses on nursing care of hospitalized patients and ill patients. It does not focus on health promotion, primary prevention or disease prevention. If available, the nurse may have a goal for the individual to return to the baseline behavior. So the nurse should know about the baseline behavior, then only she will be able to take back. The model with the nursing process is a nurse-centered activity, with the nurse determining the client's needs and state behavior appropriate for that need. Here, person is given limited importance. Johnson's model and nursing process. How to apply Johnson's model in the hospital setting. First is assessment. We have to assess all the 8 subsystems. Second one, nursing diagnosis. It tends to be general to the system than specific to the problem. Here we are not considering the problem. Nanda diagnosis, nursing diagnosis is based on the problem, but here we are thinking about the system. According to Grubb, proposed 4 categories of nursing diagnosis which is derived from the Johnson's behavioral system model. It is these 4. Insufficiency. Insufficiency means does not get enough of something. When some subsystem is not functioning sufficiently, that is insufficiency. Discrepancy means there also it is not optimally working, up to the level it is not working. Incompatibility, there is a conflict in the subsystems. Dominance, one system is always used or one system is affecting the other system. So these are the 4 nursing diagnoses we have to create when we are making the diagnosis. Planning and implementation. This may be difficult because of the lack of client input into the plan. The planning only is done by the nurse. Plan will focus on the nurse's action to modify the client's behavior to bring about the homeostasis. The plan may include protection, nurturance or stimulation of the identified subsystem. So that functional aspect the nurse will be seeing. It's a nurse-driven model. Protection from noxious stimuli that threaten the survival of the behavioral system. Nurturance which provides adequate input to sustain behavior, and stimulation to continue growth of the behavior and counteract stagnation. So these are the main things we will be doing in planning and implementation. And last, evaluation based on the attainment of goal of balance of each subsystem. We will be seeing whether each subsystem has reached to the balance. So this is how we will be doing the nursing process. We will be seeing this with an example. This is the example where history physical examination of the patient is taken. A 11-year-old girl got admitted in pediatric ward with fever. Her mother says, "My daughter had nosebleeds 2 months ago. Her BP was low and had high fever. She was admitted for 4 days in hospital. After discharge also the fever was there and was controlled with acetaminophen. Now again since last week she has high fever. So this is the reason why the girl is admitted. The lab results shows low platelet and low WBC. The child is diagnosed with acute lymphoblastic leukemia and the child has started with chemotherapy and antibiotics. Child has burning sensation in oral mucosa followed by anorexia and reluctance to food. She is tired and weak and doesn't want to leave her bed. Her mother says that she is injured in rectal area because of frequent diarrhea. During initial mental examination, she didn't make eye contact. In later sessions, it was found she is worried about her future. She is aware of person, place and time. She weighs 40 kg and is the third child in her family. There is no family history of sickness. She was born through normal vaginal delivery and the mother had no issues during pregnancy. Her siblings are healthy. The child's vaccination is complete. So this is the history we have collected from a patient and her mother. We will see how we are going to apply Johnson's behavioral system model. In the nursing process application, the first part assessment we told that we have to assess all the subsystems. The first is aggressive or protective. So there we understood the child has fever and her skin is warm. She is vulnerable to infection because of severe leukopenia. Her neurological and musculoskeletal systems are normal. So protective system about the skin you are telling, about the chance of infection you are telling, then about the other protective systems are neurological and musculoskeletal, but they are normal. The second system is achievement. Because of hospitalization, she is not attending school and she is angry. So she is not achieving the thing, so she is angry. Affiliative. Because of disease, she is angry, depressed, avoiding making relationship with family and is experiencing withdrawal. So attachment affiliative system is affected. Dependency. She has fatigue and she can't do activities of daily living alone and needs help from mother. Eliminative system, subsystem, because of diarrhea from chemotherapeutic drugs, her rectal area is having skin breakdown and has painful bowel movements. She cries when defecating. Renal and pulmonary system are also eliminative system, but they don't have any problem. Ingestive system, thrombocytopenia makes the child vulnerable for bleeding. Oral mucosa is disturbed, so anorexia is also there. And other ingestive system, oxygen when we are seeing, cardiovascular system is normal with stable heart rate and oxygen saturation. The restorative system, because of tiredness and lack of activity tolerance, she cannot restore her energy and has some problem. The sexual system, she has not reached puberty, so this subsystem cannot be investigated in her. So this is the assessment which the nurse has done. So all the subsystems are assessed. Next, nursing diagnosis is formulated. The nursing diagnosis, we told that we will be writing in this way: insufficiency, discrepancy, incompatibility, dominance. These are the four terms we will be using. So here we understood that hyperthermia associated with infection is there. So we will be writing the nursing diagnosis in insufficiency in protective and aggressive system. Our goal is to reduce fever and the planning will be doing tepid sponging, training mother to reduce the clothing of the child and administering medication with physician's order. The second diagnosis we will be seeing after understanding there is a danger of bleeding related to patient's platelet count is decreased. So their nursing diagnosis which we form is insufficiency in protective and aggressive subsystem. So here also goal is controlled bleeding. Planning is injecting IM drugs should be avoided as much as possible. Rectal suppositories should be avoided. Smallest needles should be used for intravenous injections. After injection, direct pressure to be applied for 5 minutes to stop bleeding. Take care of the child to prevent falls. Hard toothbrush should not be used for brushing. Severe coughing and nose bleeding, nose blowing should be avoided. To prevent cracks of the lip balms can be applied. So these are all the planning. Next nursing diagnosis, when we have assessed infection associated with patients white blood cell fall, we can understand. So there also protective and aggressive system insufficiency is there. So we will be writing insufficiency in protective and aggressive system. So the goal is to control infection. Planning, we will be using sterile gloves and care, daily care of IV location, catheterization only if needed, assess the fever, redness, pain, chills, tachycardia. Then the eliminative system, if we are seeing, there is disorder in skin integrity of the rectum in connection with the use of chemotherapeutic drugs. So here also we will be telling insufficiency in eliminative subsystem. Maintaining skin integrity of the rectum is a goal. Teaching how to clean the perineum, training sitz bath and drying the perineum. In the next one, next diagnosis, you can see it is not insufficiency, it is discrepancy in restorative and achievement function. So here the exercise intolerance is there due to anemia and function. So it is not insufficiency, we can tell discrepancy, it is not optimally functioning. So we will be controlling the child's fatigue. We will engage in activities along with rest. Physiotherapy you can give, all activities. So that is about our nursing diagnosis and planning. When we are planning, we need to see about the structural needs of the system and the functional needs of the system. So each subsystem, what are the structural needs? Structural needs, we know that it is divided into 4. Goal, set, choice and action. We can see a few. For example, the child's affiliative system. Affiliative system, the child is having anger, we told. So the goal is to prevent anger. What is the set of things we need to do? An intimate relationship should be maintained with the child. The choice is the mother and child can accept the training or refuse the training. If they are accepting the training, they will be implementing that action. If they are refusing, they won't be doing that action. Ingestive system we can take. There we are there to prevent the anorexia, stomatitis and the mucous membrane damage. The training we will be providing about proper nutrition patterns and preventing damage as a set, and the choice is their acceptance. And if they are implementing, that is the action. All the 8 subsystems we will be doing the goal, set, choice and action. The functional needs of the subsystem also we need to see. The functional needs are protection, nurturance and stimulation. One example we can see the functional need of the eliminative system. The functional need protection is prevention of the damage of the rectal mucosa. How to nurture is we need to train mother and child in the field of perineal hygiene. So it will be nurtured. Stimulation is by providing health requirement in section to make the child able to clean perineal area after bowel movement with the help of her mother. All the needed things we will be providing to the child and the mother. And also the aggressive or protective system, you can see we need to protect from prevention of infection, fever and bleeding. Nurturance is by training. And regarding the nutrition, we will be telling. The stimulation is by avoiding unnecessary meeting the people with cold, avoiding flowers or using raw vegetables and fruits, isolating the child, then prevention of doing a lot of activities and severe physical games, checking the child in terms of bleeding and fatigue. So these are all the functional needs of the system. So when we are planning the nurse's action, we have to see the structural needs and the functional needs of the system. Last step of the nursing process, evaluation. So evaluation of the child, this particular child was done after 10-day period and showed improved appetite, better relationship with all medical team members and family, and no sign of bleeding, fever or infection. Johnson's model and characteristics of a theory. As already told, the typology of this is a conceptual model, not a theory. That means certain criteria are not met of a theory. One is theory interrelate concept, but here it is not shown how it is interrelated, how all the concepts are interrelated, it is not shown clearly. Theories are logical in nature. A nurse using this model can use any assessment tool to fit a problem. So this is correct. Third one, theories are simple yet generalizable. But we have told that this is individual oriented. We cannot use it for family. So we cannot generalize it. Here also it is not meeting the criteria of a theory. Fourth one, theories are basis for hypothesis that can be tested. But this model, it is very difficult to test something. Theories contribute to and assist in increasing the general body of knowledge through research implemented to validate them. However, this model, it is very difficult to be used in practice. Sixth one, it can be used by practitioners to guide and improve their practice. The quality of care given by the nurse may be lessened because of fractionalized care, which does not support seeing the individual as a whole adaptive system. We will be seeing each subsystem separately. As a whole, the nurse will not be able to see. So it is quite difficult to apply in practice also. It must be consistent. The theories must be consistent with other validated theories, laws and principles. Of course, this theory is consistent with other theories like the system model and also Nightingale's model. So it is related to other theories, laws and principles. So certain criteria for a theory are not met by Johnson's model. So it is considered as a conceptual framework. Johnson's model advocates fostering efficient and effective behavioral functioning in the patient to prevent illness. There is a potentiality for the further development of this theory. As new or novice nurses, we can also further develop, contribute to this theory and can find some research problems that have both theoretical and practical value. And nursing curriculum also can be developed with this model. Hope you understood Johnson's behavioral system model. Thank you so much.